Ab Interno Schlemm's Canal Surgery, a comprehensive guide to navigate the canal with precision. Touch, tear, and thread techniques. Enter the canal. In developing countries where money, education, and dependency on caregivers remain the major challenges in the treatment of any chronic disease like glaucoma, MIGS can prove to be a blessing as it spares the sclera and conjunctiva, rehabilitates the patient earlier, doesn't alter the anatomy of the eye to a great extent, and can easily be combined with cataract surgery. Although MIGS can be cost prohibitive, we wanted to explore some low-cost options for the developing world, which would touch, tear, and thread the canal. Meet Dr. Ananda, a young and passionate ophthalmologist who is eager to make a difference. She attends a medical conference where she learns about minimally invasive glaucoma surgery from glaucoma stalwarts. Dr. Ananda begins her journey by observing her mentor perform a MIGS procedure, touching the angle of the eye. She is intrigued by the potential of this innovative approach.
I said, empty your mind. Be formless, shapeless, like water. Be water, my friend.
She empties her mind and lets her fingers do the practice of intraoperative gonioscopy, the first step for any MIGS procedure. For this, the surgeon needs to tilt the microscope 30 to 35 degrees towards and turn the patient's head 30 to 35 degrees away from yourself, lift the operating table, keep a low magnification, and gently place the Swan-Jacob gonial lens on top of the cornea, over a good amount of cohesive OVD. As the angle structures come into view, slowly increase the magnification. So started the journey of MIGS, looking beyond the angle structures and trying to touch, tear, and thread the canal. 1. Touch. Try to touch the trabecular meshwork using a cyclodialysis spatula in the beginning, while practicing intraoperative gonioscopy on your routine cataract cases.
It is like a finger pointing away to the moon. Don't concentrate on the finger or you will miss all that heavenly glory. Do you understand?
2. Tear. Cahook dual blade or KDB glide. Invented and modified by Dr. Malik Cahook, this device has a 90 micron tip to enter the canal and a 203 micron wide shaft which has a ramp to lift the trabecular meshwork, and dual blades which excise the meshwork as it glides inside the canal, which has an approximate diameter of 250 microns. The low-cost alternative of KDB for the developing countries is bent ab interno needle goniectomy, or BANG. The brainchild of Dr. Arsham Shabani involves bending the tip of a 25-gauge hypodermic needle and sliding it inside the canal, excising 3 to 4 clock hours of meshwork. One can see nice episcleral venous fluid wave after completion, which is a good indicator of surgical success. 3. Thread the canal. Now Dr. Ananda determines to try the most challenging technique of threading the angle with a Prolian suture, that is gonioscopy-assisted transluminal trabeculotomy, or GAT. Here are some tips for suture GAT. 1. Make a perfect flange which is atraumatic and not large enough so as to create a false passage. 2. Make a small initial goniotomy large enough to house the flange tip of the Prolian suture. 3. Strokes for advancing the suture should be circumferential and not perpendicular or tangential to the canal. 4. Opening of the MST forceps just enough to grasp the suture and not touch Descemet's membrane or cause a DM detachment. For all MIGS procedures, remember to keep the head above the heart in reverse Trendelenburg position to avoid excessive bleeding from the canal. To be gentle in holding the gonial lens so as to avoid corneal striae, and repeated refilling of the anterior chamber with OVD. To leave a small amount of cohesive OVD after doing KDB, BANG, or GAT so that the tamponade effect minimizes the chances of post-op hyphema. To ask the patient to sleep on the side of surgery so that hyphema collects on the temporal side, keeping the nasal collector channels unobstructed. Dr. Ananda analyzed her GAT, KDB, and BANG surgical outcomes. Maximum IOP reduction was seen with suture GAT, although hyphema was seen in almost 75% of patients, which resolved within a week's time. On average, the number of anti-glaucoma medications reduced by 1.5 to 2 after these procedures. Having mastered touch, tear, and threading of the canal, Finally, Dr. Ananda became water herself and started training other glaucoma fellows.